All right, thank you so much. So I'm happy to be back at Project Echo to give a pediatric COVID-19 vaccination update. As is the case with all COVID-19 talks, I just want to disclaim this is as current as possible for those who've been following along. Yesterday, or this week, should I say, the Advisory Committee on Immunization Practices voted to recommend Novavax as an adult vaccine. I'm not going to cover that, but now there is that new vaccine that is available for 18 plus. But today we're going to focus on the pediatric COVID-19 vaccination updates that happened mostly last month. So I thought it would be important to go back and review what is the impact on children and adolescents when it comes to COVID-19. For people to take action to change something and to do a certain behavior, they need to know or feel that the risk is severe enough to take action to that. And so when it comes to COVID-19 and how it impacts children, I think early in the pandemic, there were we frequently study, well, kids aren't impacted, but we have learned that that is not the case, and that's what I'll kind of start with. So we'll just kind of go over the different impacts here. When it comes to cases, so since the beginning of the pandemic, or even just a little bit before it was officially declared, there's been over 89 million cases reported to the CDC. Just this past week, there's been about 134,000 cases. But I want to caveat this. These are cases that are reported to the CDC. This is grossly underreported at this point because there's so much home testing happening. Last week, there was a report from Walgreens stores that reported individuals who present to Walgreens stores and are being tested for COVID-19, 42% of them were testing positive. So that's a significant number, and there's been projections that this number could be 7 times what is being reported to the CDC. So certainly very much continue to see cases, continue to see hospitalizations, particularly with the new variant. So when it comes to children in particular, just within the past week, as of last week, there were 75,000 cases of child cases added. And then this graph kind of shows that comparison between adult cases and child cases. So yes, adult cases do still are larger than children. But if you look just from the beginning of the pandemic, when 2.6% of the cases were child cases, now just in this past week, 11.7 of the reported cases were child cases. So we've seen more and more children test positive, and we're continuing to track these numbers the best we can, although there are limitations now on how much that's being reported. So how severe is the disease in children when it comes to COVID-19? And so this is data from, as you can see there, December 2021 to March 2022, which is really when we saw the Omicron period. So based out here, the red is our youngest population, the light blue are 5 to 11-year-olds, and then dark blue 12 to 17-year-olds. So you can see that this young population, 6 months to 4 years, during this period required higher amounts of ICU treatment, including oxygen support, either high flow nasal cannula, BiPAP or CPAP, or mechanical ventilation. And so I think as we've talked about the importance of vaccinating all eligible individuals, particularly this youngest group, they do face severe disease, as we saw here during the Omicron period. And COVID-19 is actually a leading cause of death among children. You can see here for every age group, it's within the top 5. And so we do see that COVID-19 has caused both significant morbidity and mortality when it comes to the childhood population. And these last few slides have been from the Advisory Committee on Immunization Practices. And I think this is really important because although I think every infectious disease deserves their own right, and I try very hard not to compare infectious diseases to one another, these are other vaccine preventable diseases that are routinely given to help prevent these diseases. And if you look at them and what the average deaths per year are, COVID-19 is far higher than even what we see: varicella, chickenpox, rubella, rotavirus, and even meningococcal. So I think when we're talking about the severity of disease and other vaccine preventable diseases, COVID-19 certainly deserves that recommendation to try to help prevent these deaths in our youngest population. So what are other impacts on children? So we still continue to see multi-system inflammatory syndrome in children. This is that severe hyperinflammatory syndrome, happens 2 to 6 weeks after someone has an acute SARS-CoV-2 infection. 60 to 70% of those patients get admitted to the ICU. You can see here data from the CDC. There's been over 8,600 cases and unfortunately 70 deaths secondary to MIS-C. The median age is 9. The range has been from 5 to 13 years, and there is a higher report in males. And then, as we've seen in other cases, there is a disproportionate impact on minority communities, where you can see here 57% of those who reported were either Hispanic or Black non-Hispanic. And then what are the other post-COVID conditions? We're still learning a lot about this. So we hear more and more about long COVID, where we think 1 in 20 people who have COVID-19 disease will have lingering symptoms and have long COVID symptoms. And when it comes to the pediatric populations, we know that children who are hospitalized or have more severe illness, or those adolescents in general, tend to have more of those post-COVID conditions. And what remains uncertain is, how frequent are those, how severe, how long do they last? Are their groups disproportionately impacted? What about these variants? And does that, or do we see more post-COVID symptoms with certain variants? And then what is that impact on daily activities and participation in school? We know that the pandemic has caused a great deal of disruptions in school and in learning and on daily activities for children. So let's shift now and talk about, what COVID-19 vaccines we have available now for the pediatric population. So I know that this is a busy slide, and as I said, this is not does not reflect Novavax, which was just authorized this week, but before they just updated the clinical considerations. So this does not reflect the Novavax, which is the 4th vaccine type available for adults, but it's not recommended for under age 18. So here you can see the difference between if you're considered immunocompromised or not moderately to severely immunocompromised, and how many doses make up the primary series compared to who boosters are recommended for. So as you can see, there is a difference. This is incredibly complicated information. And in West Virginia, we have a tool that I'll share at the very end that hopefully will help individuals in navigating the differences and knowing how can you stay up to date on COVID-19 vaccination. But I think it's important to know that there are different recommendations depending upon if you are moderately to severely immunocompromised or not, including even for our youngest. So you can see here for ages 6 months to 4 years, there's still there's a 3rd primary dose that's recommended in that primary series. There's no booster doses recommended yet for under age 5, but depending upon your age, the vaccine that you received, you might vary in the number of doses that are recommended in regards to having booster or not. And so I think it's important that we continue to follow this and keep ourselves updated on information. We are anticipating a fall Omicron specific variant. So this will again change as there's an Omicron specific variant vaccine booster shot available sometime this fall. So we'll dive a little bit deeper into these. So last month, Pfizer BioNTech vaccine, which has currently been prior to June of 2022, the only vaccine available for our pediatric population. It is an mRNA type vaccine, but it was authorized in the CDC. It went through its traditional process where it goes through the FDA, their independent advisory group, then it goes over to the CDC, their independent advisory group meets, and then the CDC signs off. So the Pfizer BioNTech is a 3-dose primary series. The Moderna COVID-19 vaccine is now the 2nd product we have available for under age 18. This is the first time really that we've seen in the entire rollout 2 different vaccines rolled out at the same time, which adds to the complexity. So the Moderna vaccine, 6 months through 5 years, is a 2-dose primary series. And now there's an option, Moderna, 6 years through 11, and then 12 years through 11. Those are also 2-dose primary series. They're all different. products. So it's important, we'll kind of dive into that. So really, what are going to be the challenges ahead as we see these new products? Really, I think it's access, communication, and education. So pharmacies have played an incredible role in helping to vaccinate our communities throughout the pandemic. Pharmacies are only able to vaccinate individuals 3 years and older. So for that population under age 3, they're really reliant upon their physician's office, their provider's office, or the health department. They're not able to get access at a pharmacy. And I think it's important to know, where is this vaccine available, and then doing communication to the public so that they're able to understand where they can get that, as well as education. So thanks for being here today to learn more, because certainly from following, being involved in the vaccine rollout before there was even vaccine available, this is incredibly complicated stuff that we continue to face. So when you talk specifically about Pfizer BioNTech for 6 months through 4 years, this maroon product over here on the left side of the screen, when you're looking at it, is really the product that's available for 6 months through 4 years. So it has the same vial cap and border color. It does require to be diluted. The dose volume is 0.2 mLs, and this is a 3-dose primary series. You can see here other age products, so 5 through 11, 12 plus, and then the gray product is the only Pfizer product that does not require dilution. I want to be very clear, you cannot use one of these other products and dilute it more or draw up a similar dose. As you can see here, the amount of diluent per each is different, and the dose volume is even different upon the age. So the vaccine is really age specific. So at your location, it's really important to know what vaccine is available and to review any policy and procedure you have to help prevent vaccine errors. To add to the complication in this newest formulation, the dose of the vial might have something stated differently than what the vial is able to be used for. So what I mean by that is that the vial label may state ages 2 years to 5 years or ages 6 months to 5 years. Either of those products labeled that way are permitted to be used for 6 months through 4 years of age. This was partially due to a great deal of vaccine was created when the thought was that we were going to be able to see vaccination in ages 2 to 5 years. Unfortunately, it didn't pan out, so there needed to be additional doses, and so there was additional time, and many of these vials were created, and it would have resulted in lost product. So I know that makes it super confusing because we're telling people, look at the label, but now we're telling you, look at the label, and in this situation, it is permitted to be used outside of what you see in the labeling. When you go to Moderna, there's 3 different products that we now have authorized for our pediatric population for the first time about a month ago. So these have different cap colors to label colors. So again, adding to the confusion, this dark blue cap magenta label is the product for our youngest population, so 6 months through 5 years. The primary dose is 0.25 mLs. These products do not require any dilution. And as you can see, there's not yet a booster dose recommended for that age group. The teal product here is the product that will be available for 6 years through 11. Unfortunately, this is currently not available in the United States. So the recommendation in the directive is to use the dark blue cap purple labeled product, as you can see here, is for 6 years through 11 and also 18 years and older as booster doses, which we'll talk about in just a second because it also has a labeling discrepancy. And then the 12 years and older primary series, as well as the 18 and older booster doses, you can see there have the red cap color with the light blue border label. So all somewhat confusing, particularly if you have challenges with color, but I think it's very important that we continue to look at the labels and have these wall charts available in any place that is offering vaccine to make sure that we're double checking it. So similarly to the Pfizer product, the Moderna product also has a labeling discrepancy. So this Moderna COVID-19 booster dose only is authorized to be given for ages 6 through 11 years, 6 years through 11 years. It's also a multi-dose vial. It does not require any dilution, but that teal border, as I stated before, is not yet available. So although this says booster doses only, this is authorized for use for ages 6 years through 11 for that primary series dose. So the primary series is that initial set of shots that people get for their immune system. Booster doses are over time, as immunity wanes, we're offered booster doses to try to help rebuild that immunity. Different than additional doses for the moderately severely immunocompromised. So certainly appreciate this is complicated stuff, but again, important to know what your office site is offering, and make sure that you're having policies and procedures in place for either of these products. So what are some COVID-19 vaccine considerations for pediatric population? So the correct dose is based on the child's age, the day of vaccination. Frequent questions we receive is, my child is 4, they're going to be turning 5 soon. Should I wait to be vaccinated? I don't recommend delaying, and that's not what the AAP, the American Academy of Pediatrics, or the CDC recommend. You should get vaccinated as soon as you're eligible. Another question that I get, that question is because, should I wait so that they can get the higher dose vaccine? If they're 4, should we wait until they can get the 5 age Pfizer product? Another question we get is, your child gets vaccinated and they're 4, they have a birthday, they turn 5, and what vaccine should you use then? And the CDC has, and the AAP have different resources available to help navigate those situations. It is recommended to use the child's age and use the product for that child's age. However, there are permissions that if you would complete the series with what vaccine product they started with, that would also be acceptable vaccination. So COVID-19 primary series is recommended for everyone 6 months and older, regardless of the underlying medical conditions. Another frequent question we receive are, what are the side effects for this age population? It's actually quite similar to the adult population in regards to the types. We've seen the severity actually less. So children tend to have less or more mild symptoms, I should say, in regards to side effects. Pain, redness at the injection site, swelling being some of the most common. And then we do see fever in children, particularly more so with the Moderna product, but you can also see fatigue, headache, chills, muscle aches, joint pains, and lymphadenopathy. It's important, and I'll talk about this in the next slide, that COVID vaccines can be given at the same time or around the same time as other vaccines, particularly for this youngest population, because this is the time that they're frequently getting other vaccines as part of the routine immunization schedule. So it's important to note, as well as we move into the fall and flu shots will be recommended. Again, COVID-19 vaccines can be given at the same time or around the same time as other vaccines. It's not recommended to give antipyretics like acetaminophen or ibuprofen prior to vaccination, but if a child does experience any of these symptoms, those can be given post-vaccination, as is the case with all pediatrics. Do not recommend using aspirin under age 18 due to the risk of Rye syndrome. So again, multiple vaccination administration, they can be given without regard to timing of other vaccines. That can include simultaneous administration or other vaccines on the same day. If there are multiple vaccines being administered, follow standard procedures, separate the injection site by more than an inch. For older children, you can use the deltoid muscle. In most children, you're using the anterior lateral thigh, so the upper thigh, to give vaccines, as you can see there, because it has greater muscle mass. I do want to touch briefly on myocarditis and pericarditis, because this is another question I think people frequently receive. So there is a rare risk for myocarditis and pericarditis following the mRNA COVID-19 vaccination. They've occurred most commonly in adolescent and young males with that within the first week after receiving the second mRNA COVID-19 vaccine dose. You can also see an increased risk in males ages 18 to 39 following the second dose. But I think it's important to note that the risk of myocarditis from disease, so getting actual COVID-19, is much higher than the small risk associated with vaccination. And those vaccine-associated myopericarditis cases, the patient has gone on to have complete recovery, whereas with disease-caused myocarditis, pericarditis, there can be longer-lasting impact. And then this is what, because of this risk of, this small increased risk of myocarditis, the dosing interval can be different. So an 8 interval in a week can be considered between the first and second dose. For some people who are 6 months through 64 years, especially for those males in that adolescent age period. It's important to note that if people are considered moderately to severely immunocompromised, it's not recommended to have that that longer interval. So you should stick with the shorter interval to get that protection, because it takes about 2 weeks after the last dose in the series to be considered to have that optimal protection. So how are we doing after you've heard all this? So how are we doing? So this is the map of the United States, ages 12 through 17, who've received an initial dose of the COVID vaccine. You can see a wide range, so from 40% to 100%. So the District of Columbia reports they vaccinated all eligible adolescents. Here in West Virginia, we're at 50%, so not at the bottom, certainly not at the top. When it goes to 5 to 11-year-olds, you see that the screen is not as dark. And so there's been a range of 16% to 68%. So here in West Virginia, 20% of this age population has received just the initial dose. So that's not completing the series. That's just getting 1 dose of a COVID-19 vaccine. And then hot off the presses, you can see the 6 months through 4 years. So this is about a month of information. And so as you can see here, this was anticipated that there would be likely a slower uptake in this group, but it also leaves great room for improvement. So you can see 0.3 to 16.1%. So again, here in West Virginia, 1.4% of that population has received the COVID-19 vaccine, just the initial dose. So how can we help improve those numbers? A lot of it is surrounded around vaccine confidence. So just for all the healthcare providers listening today, you are a trusted source and your recommendation matters. We have data in West Virginia that has shown, as well as nationally, that local healthcare professionals are a most trusted source of COVID-19 vaccine information. The answers to questions that you're able to provide, as well as your personal fact-based, empathetic, judgment-free vaccination recommendation, is essential in boosting that vaccine confidence. These are just some messaging considerations. Continue to be hopeful, optimism, trust, and have confidence in the process. This is incredibly important from those healthcare professionals. Really helping parents, guardians, caregivers see vaccines as beneficial and safe. So that's why I went over some of what are side effects that we see, but by and large, these vaccines are incredibly safe. Try to showcase those motivating benefits, help the child get back to doing those things that they, enjoy doing. Helping remove barriers. So I talked about access. We still have places that these vaccines might not be readily available for, particularly that youngest population. If there's a pharmacy in a community that's offering vaccine, that's great, unless you're under age 3. And so reaching out to the local health department and making sure that there's easy access, as well as time. Parents work, they might not be able to take off of work. So evening clinic hours, weekend clinic hours are important to help remove those barriers. And then, as we talked about a lot at the beginning, help parents and guardians see that COVID-19 is potentially severe. It's a leading cause of death in children. And so it's important that we continue to remind parents and guardians that children do get COVID-19 and they can get very severe COVID-19. And we still are learning about the long-term impacts of COVID-19 in everyone, including children and adolescents. It continues to be important to emphasize freedom and choice. So, providing this information to parents and guardians, but really emphasizing that it's a freedom and a choice for the parent to make. So I'll just share briefly some communication resources. If you would like to have some of these posters that the state team has created, we also have lanyards and buttons. You can go to covidvaxwv.org/order, and you can order these for your own clinic. We also have coloring pages. One of the that we've seen throughout our focus groups are that children report to their parents they feel like superheroes after getting vaccinated. So you can see here some coloring pages. These are, you can edit these posters at the bottom to include clinics that you you may be involved with or offering. I encourage everyone to go to our social press kit where you can download these resources as well, as including frequently asked questions. You can also post to your social media site from there. And then the last thing I want to share is our COVID-19 vaccination due date calculator. I'm not sure if anybody is aware of this. Hopefully you are. This was actually launched in March of 2022. We've seen over 400,000 completed calculations, but this tool was created to try to help people better understand when they're due for a COVID-19 shot, because we know it's very confusing from what we talked about. So you just go to vaccinate.wv.gov, scroll down, you read the disclaimer, you click through, then you start making selections. Did you put in your birth date? Have you had a vaccine before? If so, how many? What type was your first vaccine shot? Are you considered moderately to severely immunocompromised, with the definition right there? Then you put in the date of your last or most recent COVID-19 shot, and then it gives it, that's it. You get your projected date, type, and it also will let you know if you are currently up to date. If you want to go ahead and make an appointment right then, you can do so. You can also put a calendar reminder in your calendar for when you are due. And then for healthcare professionals, we have added a medical info page that gives you a little bit more in depth. So this is currently being updated to reflect the Novavax guidance, but it does reflect the pediatric guidance that we talked about today. Here are some other resources available if you want more information. The wall charts that I referenced, there's also some just-in-time training videos that go even more in depth than what I covered today. We also have an error prevention document, as well as additional communication resources. So just remember that COVID-19 is a leading cause of pediatric death. Vaccines are available, 2 different types for ages 6 months and older, to significantly reduce severe disease, hospitalization, and death. Remember that healthcare providers are the most trusted source of COVID-19 health information, and building that confidence is crucial for uptake in our pediatric population.